About a month into Virginia's vaccine rollout, and now about 190,000 people have gotten a vaccine in Virginia out of the more than 500,000 doses the Commonwealth has received.
There's always a lag in the present day. I expect that to jump back up tomorrow.
Dr. Danny Avula is overseeing Virginia's vaccination plan for the Department of Health. Today, 11 areas in Virginia advanced into Phase 1B of the rollout. That includes a big group of people, like people over 75 and essential workers who cannot stay home, like grocery store workers and first responders. But in Hampton Roads, we remain in Phase 1A, meaning only healthcare workers and people in long-term care facilities are being vaccinated. Does that mean we're falling behind?
I don't think it's that communities have fallen behind. I think it's just that the vaccinating capacity and the demand for vaccinations among that 1A population have looked really different.
Dr. Avula says some areas have fewer healthcare workers than others and thus have moved ahead into the next phase. He says they hoped 100% of healthcare workers would want the vaccine, but in reality, that number has been about 50 to 60%.
There's a continued growing demand among healthcare workers in health systems, and so that's encouraging.
And here locally, here's where things stand in vaccination on the south side. Virginia Beach has seen the most people get vaccinated at more than 7,000, while on the peninsula, Newport News has gotten the most vaccines at nearly 3,000.
The solutions look different in every community, and there is just a lot of contextualization that needs to happen based on population, based on vaccination capacity.
The goal is all of Virginia will be in Phase 1B by the end of the month, and for now, some of us need to be patient.
What we hope is that the public really will understand the rationale for prioritization, and if you are not as high risk as somebody else in your community, that you will let them go first.
It's too soon to say when the phase after 1B would start, but it all depends on how much vaccine is available, as demand remains higher than what's available. In Norfolk, Brendan Ponton, News 3.
Now, there is a tool to help you determine which group you fall into for getting the vaccine, and we have a link to it, along with a lot of other helpful information for you. It's there right now on WTKR.com.